My name is Riley Griffin and I'm 6 years old.
I'm Riley's mom, Wendy, and Riley has acute lymphoblastic leukemia.
ALL leukemia.
He started school in primary in September and had a few cold stomach aches like you would expect with any child starting a new school, a new environment, and really didn't give it any more thought up until about March break. And he was doing a day camp and complaining of a lot of stomach aches and very tired, and his legs were very sore. So we took him in to see his GP. The GP immediately sent him up to the IWK emergency. The emergency department did blood tests and came back with an extremely low red blood cell count and indicated that he would be staying overnight at the IWK until they were able to determine the cause. Within 24 hours, we had gone from day program into a confirmed diagnosis of leukemia. Your breath stops.
You've lost your breath, and the space between the things you know is blurry nonetheless.
Time freezes.
When you try to speak, but you make no sound, and the words you want are out of reach, but they've never been so late.
They would take care of his medicine, his treatment. We needed to think about how we were going to parent through the treatment process. It's an extended treatment process, and they said at the end of it, if you want to have a healthy child, you need to have a healthy, happy child, and that takes a partnership between the IWK treating and supporting us as parents. This is a challenge to parent through, and they gave us some fantastic advice on how to have a very well-rounded, grounded child at the end of this process. Watching him having to deal with the steroids and the treatment and the hair loss. You take chemotherapy, but then you need steroids to counter the nausea, anti-acid type products to balance the difficulty from the steroids. With every new drug you introduce for the treatment, there's a basket of side effects that can happen. We've spent a lot of time focused on the side effects and not as much on the cancer itself, which the core team of his caregivers focus on. He's in the third phase of treatment, which is called the maintenance phase, and it will go from now until May 2012. So we have regular monthly chemotherapy visits, up to 5 different types of medications a day. But he's in school, he's very active, he has his swimming and beavers, and this has just become our new normal. We just view this as a process we have to go through. We've been able to be very confident in the outcome, so we only focus on getting through the day-to-day. Riley's Child Life team was fantastic in that they were able to tailor the explanation to him. So when they came in, it was very straightforward. They provided him with his Will doll that allowed him to practice putting needles into a port catheter, because Riley has had one inserted in his chest to allow easy access to administer his medication. And he was able to practice on Will and understand. They answered any question he had.
William's a doll and he has a port. I got William in the inpatient side.
What's the port for?
Putting needles in and then giving the medicine and stuff. William doesn't have any hair. I didn't have any hair once because of the medicine. My friends wanted to know how it felt to have cancer. I brought them fake bone marrow to show people what it looks like, the bad stuff and the good stuff. That's the bad stuff with the blue cells. That's the good stuff with the white, red, and platelets. The good stuff's inside me now, and the bad stuff's all out.
Did you ever feel sick when you were getting the medicine?
Yes.
And what did you feel like?
Tired. My joints hurt. Stomach hurt. Lasted about 6 months.
And how do you feel now?
Better.
One of the people that Riley really looks forward to seeing when we go to the hospital is Mary Jean Howitt, and she's our care coordinator.
She cares a lot. She helps answer our questions.
Riley really does enjoy science, so this process has been educational for him from that perspective as well. They were able to arrange a tour of the lab and got to see where they do the blood extractions and the testing. They actually had a sample of Riley's bone marrow on one of the microscope slides, and he was able to look at it and understand how they counted the leukemia cells, so it made it understandable for him why they needed his blood so often.
Trust in me, don't pull away. Just trust in me, 'cause I'm just trying to keep it together, 'cause I could do worse and you could do better.
One of the things with the IWK being a research teaching hospital, they do ask if you would be willing to participate in certain studies. And where we can, we have, because I think it is important, even though the research won't benefit Riley necessarily directly, that other families and children can benefit from this experience.
I'll be right beside you. Nobody will break you.
My name is Riley Griffin. Please give to the IWK Radiothon on C100. Call now, 1-800-595-2266.